I'm here at the East Town Mall in Madison, Wisconsin today to teach people a little bit about HIV and AIDS. It's actually a big problem in society still today, so I want to get them a little bit informed. I'm going to be interviewing people at the mall as well as giving them this pamphlet. It's going to tell them some statistics, what HIV and AIDS are, and then it's going to tell them where to get tested, because the only way to know if they have HIV is to get tested. So let's change some lives. So what do you know about HIV and AIDS?
I know that there has been a big stigma that it's only an issue for gay men, and that if you have HIV or AIDS, you clearly had sex with a gay man.
I know that it attacks the immune system, but that's about all.
Not very much, to be honest.
Okay, so you have a little bit to learn.
Definitely.
HIV stands for Human Immunodeficiency Virus, and AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is the last stage of HIV, so if you have AIDS, it came from HIV, but if you have HIV, you don't necessarily have AIDS.
Alright.
HIV attacks the immune system, lowering the amount of infection-fighting T cells, and the normal amount of T cells in the bloodstream are 500 to 1600 per cubic millimeter. So if you have less than 200, then you officially have AIDS. What can you tell me about HIV and AIDS history?
I don't know a whole lot. I know it's becoming more of a topic now that Charlie Sheen's a thing, but
Yeah.
but beyond that, I know I've just, there's not a whole lot that I know about the history of it.
Nothing specific, really. I mean, like just things that I've heard in the news of people having it, like basketball players, things like that.
Real for sure history, not so much.
So the peak of the epidemic was in the early 1980s, when one person was dying from AIDS every 8 minutes. So that's
really fast.
yes. So people's friends were basically dropping dead around them. They would see someone one day, and within a few days, if they didn't feel well, they were just gone. They were dead.
Wow.
Yeah, and the government was basically ignoring the issue because it was seen as a gay man's disease and it was deserved punishment. So they weren't really doing much to look into finding a cure or some type of treatment. And then when there finally was a medicine, it was $10,000 per year, and the biggest side effect is that it caused blindness. But today there are more treatment options, which we'll talk about shortly. And what do you think the typical life expectancy is of someone with HIV?
I really don't have an educated guess. I'm going to throw out like 6 to 7 years.
52.
I know that in first world countries that there's a lot better prevention and treatment so that AIDS itself isn't as much of a problem as it used to be. So, and people can actually live with HIV, so their life expectancy doesn't drop as significantly as it used to.
Taking medication daily, which is really important for people with HIV, can increase their life expectancy to just the same, almost, as anyone who doesn't have HIV.
Oh.
Yeah, so they've come a long ways. And the medicine is called antiretroviral therapy, or ART for short. And this basically came about from people with AIDS and their advocates fighting for a long time against the government and the Food and Drug Administration for testing of the drugs so that they could get better treatment. What groups of people do you think are most affected by HIV and AIDS in America?
I mean, the only one I've heard of lately is a celebrity, so I guess we can say the high rollers.
Well, I've always heard about gay men, but I'm sure that's not accurate.
Poverty-stricken minorities.
Well, actually, 25% of people who are HIV positive are women, and they've contracted it through sex with heterosexual men. So it kind of doesn't target anyone in particular. It's more if you're having unprotected sex, you're susceptible to it. If you're sharing needles with someone who's HIV positive, they might not know it. 1 in 8 people who has HIV doesn't actually know it. And that increases to 50% of young people who have HIV don't know it. You can also get it through birth from mother to child if the mother has it, or breastfeeding, and through blood transfusions as well. What do you think are ways to prevent transmission?
Well, you had mentioned it's through the sharing of needles and having unprotected sex with partners that do have it themselves. So I'd say those are really big ways. Not doing those things would be great.
Well, I think a lot of common sense things like have safe sex and make good choices. Don't stab yourself with a needle that someone else just used.
Wear condoms. Don't get blood on you.
Mm-hmm.
Don't do drugs and then share a needle with someone. I don't know.
Great.
Yeah. So, yep, condoms and using sterile needles are two ways. There's also a medication called PrEP. So if your partner has HIV, you can take PrEP, and it's basically an HIV medication that people with HIV would take. And this is just going to prevent you from getting it. People who are HIV positive and taking their daily medication, the antiretroviral therapy, they reduce their chances of transmitting it by up to 96%.
Oh, wow.
Yeah. So what would you say is the most shocking thing you've learned about HIV and AIDS today?
I would say it's really shocking that of the young population, 50% don't know that they have it. That's an insanely high number.
Yeah.
I think the fact that medication reduces the risk of transmitting it that much is pretty crazy.
Mm-hmm, definitely.
Yeah.
There was a medication that the partner of an HIV positive person could take. I didn't know that beforehand.